Board of Health meeting to order. And who's all here? Who's not here?
Here.
Wayne's here,
Mike's
Lauren,
here.
Amy, Mike.
Yeah,
Debbie has stepped down from the Board of Health due to a move,
right.
and Henry is excused. And then James, I'm not sure if he'll be here tonight, and Dr. Golden's excused as well.
So, that being said, is this a quorum?
This is a quorum.
Oh, okay.
Mhm.
Well, good. All right. So I guess we should approve the minutes from
Move
August.
to approve. August 12th
Second.
minutes.
Oh, okay. Do I hear a second?
I'll second it.
Okay. And
Great.
the agenda is approved from August 12th. Citizen comments, I see no citizens. So we'll move on to unfinished business.
No unfinished business.
No unfinished business, all right. Then to new business. Administrative updates.
All right. Before jumping into the 2025 budget, I will give an update that we had the public health nurse opening from when James Capera moved to a different position. And we extended an offer, which was accepted by someone you may know, Lori O'Neill, from formerly the Franklin Public School District, and she once was on the Board of Health. So she'll be joining our health department at the end of December, which is exciting for us.
Short hair, right?
Yes, shorter
Okay.
hair, yep. She
Yes,
has a
okay.
lot of experience
Yeah.
working in Franklin, working in a similar field. She's a Franklin resident and has
Awesome.
interacted a lot with our department. So she has a handle and knows what she's getting into to an extent.
Well, very
So
nice.
we're excited to onboard her. For the 2025 budget updates, a public hearing and final approval of the 2025 mayor's recommended budget is going to the Common Council meeting on Tuesday, November 19th. We do not anticipate the social worker position to be funded. That did go forward to the Finance Committee, but it did not make it in the draft budget for 2025, and I've heard no further comment on that being funded. So that was the 0.3 from fire, 0.3 from police, and 0.3 from health request.
So it was a full-time position,
Mhm.
but divided
Into thirds, yep,
thirds, yeah.
to do those case management, social service referrals. So we'll see. I've had quite a few inquiries from the public and from partners about hearsay of, oh, I heard this might be funded, or I heard we finally might be getting one. So it sounds like there's even interest from people who might not be the recipients of the care for the social service referrals, but that's exciting that there's a little bit of buzz around it, so maybe promising for future years. That is all I have for administrative updates.
Clinical service updates.
All right. Now we'll have to remember that we're reflecting back on quarter 3. So we're a little bit removed from that now, given our November date. But in quarter 3, so July through September, we gave 298 immunizations. So that does not include the bulk of flu clinics. I did write that down just to give you guys a peek on that, though. But as of today, November 11th, we've given over 500 flu vaccines in this flu season. So that's exciting.
Is that a lot or a little for?
That's average. Usually 100 or more, like usually 600. So we anticipate giving about 100 more. The senior health and wellness fair was a little bit down from past years, but we also think that might be because people are aging out of it. Like maybe people aren't coming as they're getting older, and so we need to tap into our younger senior population to get them to that health and wellness fair. But we still saw a lot of people there, and it was really robust.
Do you have people fill out like age or anything like that when they come to it? Do they have like a demographics?
We
You
do
could get
have
that information?
demographics if we were to pull it in this regard, because almost everyone who comes, I would say 95% of the people who come get a flu vaccine when they're there.
Okay.
So we would be able to pull that out of our system. But yeah, looking
Just
at the
curious
data
to see,
trends.
yeah.
I don't have it off the top of my head, but I'm sure we'll be looking at it because we've been kind of toying around with what's next. But attendance isn't an issue really because it's packed, but we just want to keep it that way.
Yeah.
And keep the attendance high. And then we are now accepting or still accepting walk-ins to the health department so people can come in and call in for a flu shot. All right. That is my update on clinical services.
Is there a cost to that then?
We do bill for it, so we can bill insurances. We're working with our medical advisor, Dr. Golden, right now to be able to bill additional insurances for the goal of next flu season.
So right now you only bill Medicare?
No, United Healthcare, I think,
Oh.
and one other one. I'll have to look. It's on our website, but it's only a handful. So we're looking to add Aetna and 2 other of the top ones that people call about. We've been tracking it for a few years now.
Sure.
So hopefully we can add that. It's a nice offering, especially when it's tied to the health fair. So that
Yeah.
people coming anyway don't have to find another source for it. Or people can pay cost, but when you can go other places for your insurance.
So it's usually United Healthcare, Medicare?
And a couple other ones, but I can't remember them
It
off the
is
top of my
Medicare,
head.
I believe, with United Health.
And then we also we currently in stock have COVID for adolescents, but we're getting adult COVID in the near future. So that is on order, and that's different for us. We haven't had that in the past quarter or 2. The demand wasn't there, but we're finding a lot of people are pairing that with their respiratory season, saying, oh, do you have COVID and flu, and are looking to get both. All right.
So, that was the communicable disease report?
That was clinical services.
Oh, okay.
I can hop into the communicable disease report if you'd like.
That would be great.
All right, so again, remembering quarter 3 this is, and you probably now have heard a lot about pertussis, but pertussis was starting to tick up in quarter 3, and that was mimicked in our numbers here in Franklin. We saw quite a few cases. You'll see your supplemental Franklin quarterly communicable disease report, so that's a table here that shows both what we are doing and then what we're seeing in Milwaukee County as a whole. So pertussis was ticking up, but we often see this every few years, so it's not so shocking, but just new to some people here. The majority of our communicable diseases were respiratory in nature, sexually transmitted infections, always we're seeing that, so that's nothing new. But we are recommending people check their vaccination records, so go into WER and look to see if they're up to date on their vaccines. Pertussis does have a vaccine with it, so we're making sure to get that message out there.
Okay, great. Health Department programmatic updates.
All right, in July through September of 2024, we had quite a few activities as the health department. We wrapped up our park concert education, so here at Lion Legends, going to the music in the park. We attended the Franklin National Night Out, so hosted by the police department in the library parking lot. We had a resource table there to connect with parents and primarily families as the audience at those events. We hosted a nutrition session with how to make a smoothie presentation for like a variety of age audiences at the Franklin Public Library. And it had huge demand. About 45 people attended. So that was interesting and something new for us. We switched our spring wellness fair to be in the fall this year. We have found historically lower numbers than we were hoping to get in the spring. So this year we tried something new and partnered with the school district and did it as a fall family run. So that was good. It drew about the same, but it was less demand on the health department, and then we were able to pull in more partners, so hopefully reaching a slightly different audience of just more families in general. Volusia Franklin had their middle school and high school open houses for the school year. We started doing that a few years back where we'd go and advertise about the club so that kids and their parents could learn on the first day when they're getting more familiar with the building in itself. And that's always had a great response. So we're able to yield more members to join the youth groups for substance misuse prevention at that. Over 300 people came to the Adult Health and Wellness Fair and dozens of vendors. So that was wonderful. It's always a long list of people wanting to be vendors, and Carol in our health department has the conversations with what they can offer and looks for the services that we might be missing or gaps to fill, being really mindful of who we're having be the vendors there for a well-rounded event. I just had made note of what I mentioned before. As of today, over 500 flu vaccines given in this flu season. And we wrapped up the quarter with Trunk or Treat at the beginning of mid-October with over 40 organizations and 1,200 children. We also did a food.
That's huge.
It is huge, and we did a food drive as well. So I think that we could increase the messaging for this, but we work with Feeding Franklin, which is a coalition of all the food pantries that are here in town. And we have the event free, so no charge for participants, in hopes that they would then bring a non-perishable food item for donation. We had about 90 items donated, which is wonderful, and we're happy to have that and hoping to even increase that in the future. So we'll see. We'll have to work on that messaging.
I wasn't aware of that even.
I know, it's tricky. I think that people are so excited to register, and then they register and don't really notice, but we don't want to overburden people or make them feel bad if they don't. However, we also are just trying to brainstorm ways to get the message across that this would be really a helpful cause, and we're getting so many people there that it just makes
Yeah,
sense.
it's an audience, yeah.
It is.
So 1,200 individual kids registered.
Mm-hmm. So this year we did. We've been tweaking it for years of just trying to find the sweet spot, because there's no way that we could not have registration, just to be able to manage that from a safety standpoint alone, because the auxiliary and Franklin Police Department come there to help us, and also our trunks then bring candy for everyone. So that's on them to bring it, so we keep them up to date on the numbers. But this year, instead of having the parent and the kids' names listed, we just had the kids. And then if parents were loitering around with them,
Is that just limited to Franklin, or anybody can sign up?
anyone can sign up. Mm-hmm.
Is that the most you've ever had, 1,200? Or?
It is, but not by much. Like, we've had over 1,000 people. So the trunks do a great job, and I think that's too because of the foresight of the organization. So they commit while they're signing up. So if you're saying, oh, I'm here with the Board of Health and we're having a trunk, I agree to bring 1,200 items to give away, like a healthy or fun alternative. I plan to be there all night, so we don't let vendors leave early, and then not use substances is the other one. But
The weather was wonderful.
it was so wonderful. It was
Just to
great.
walk around and see all the little costumes. There was some little girl pulling a pillowcase of candy behind her. She
Wow.
couldn't carry it.
Oh
And
my
I
goodness.
think the pillowcase was bigger than she was.
Gosh, it really, yeah, it feeds into that goal that the Franklin Health Collaborative has for community connectedness. So that's a major reason that we do it, to bring people together. Every year, Volusia Franklin has hosted the free outdoor movie night in City Hall's lawn. And this year, they worked out like a contract with the movie people to then come to Trunk or Treat. So this was the first time we had that as a feature too. So that was neat. There was little like kid-friendly music videos playing.
Awesome.
Mm-hmm. All right.
Okay, that brings us to education.
All right, I kind of blurred it all together. But
Oh.
those are all different fun components we have, but at every single one of those, we're doing an education of some sort.
Yeah.
So our main priorities as a community health improvement plan or Franklin Health Collaborative are mental health, physical activity and nutrition, and community connectedness. But then the health department additionally has all of the other statutory requirements that we focus on. So we're doing maternal child health, emergency preparedness, and trying to integrate those into everything that we're doing. A major goal that you'll see coming into 2025 will be creating more or less of an identity for the health department of what people think of when they think of the Franklin Health Department. It's kind of an ambiguous place to describe what you do here. So we're just going to be working on getting the word out there more about not only what we do, but what exactly we do. Because we'll get some calls that are just not quite what a local health department does. Always happy to help or try to find a resource, but that'll be something we're working on next year.
Okay. Environmental health updates.
All right. This is not necessarily what occurred in in quarter 3, but we have our program evaluation coming up next month. So every few years we have a program evaluation because we're agents of the state for licensing. So we license restaurants, mobile and temporary pools, hotels, motels, and this program comes in and does a review of everything that we've been up to, our inspection numbers, how we're doing things, our programs and policies. So our staff have been busy at work doing that. And in quarter 3, so July through September, we had 115 inspections that we completed, and about 81 of them were routine inspections, so those brick and mortar establishments. You'll see the breakdown here, but we also do follow-up. So if we go there and just a couple things need to be fixed or addressed, we'll go back and help people work that out. But we have an influx often. We used to actually only see it in the summer with mobile food trucks. And it used to be a peak that we would see in the summer and go away. But now, events are happening year-round. So I don't think we'll ever see a peak like that again. It'll just be maintained at a very high level of service needs, especially in a growing community like ours. So I expect that to be just as high next time we all talk to each other.
Well, with the Rock, right? I mean, lots of activity there.
Yeah, bigger establishments like that draw just more opportunity.
Yeah. Well, good for you. So that covered inspections too, right?
It did.
Or did it?
Yep, so that's with our one full-time sanitarian, and then we have another 0.1 sanitarian that we've grant funded to be 0.4 worth of time. And we're maintaining that into next year with grant funds. But when that sunsets, we will really need a look of how we're going to sustain that, because it would be naive to think that we wouldn't need that FTE permanently increased. We're incredibly busy as it is, and the numbers don't even really tell the whole story, because with more establishments bring more calls of just, what kind of license do I need? Can I do this? Is this the process that I need to follow? And it's a lot of pre-work that goes into new businesses opening, and that takes a lot of time on our sanitarian staff specifically and our administrative clerk. So we'll have to really look at the plan for the 2026 budget. But until then, we're very happy to have written and received grant funding to maintain that 0.3 increase.
And who is that grant through?
That we're using through COVID dollars.
Okay.
So post-COVID recovery is why we wrote for it, because when businesses were closed and then they were open, it was a huge catch-up of doing inspections and then just carrying that forward into the future years.
Maybe next year, before we go into the budget cycle, which is, starting in June or whatever, maybe you could tell us, or at least have some indication as to things that aren't getting done. What would you like to have done that isn't getting done with current dollars? And that might be a way of looking at how we structure something for the request and so, I mean, that's just a thought.
Yeah.
You gotta give your
Definitely.
request some weight.
Yeah, and I think that's too sometimes when it's not advantageous to make do with what you have. So you try to like string things along or overwork yourself, and then it just gets you into a situation of sorts.
Yeah.
So yeah, at some point you just have to
It's
say
wonderful, all the things that get done, but maybe there's some things that aren't.
right,
I don't know.
right, like the dream list.
Okay.
And we really need to be getting this done, but just can't get to it because of the shortage. Definitely. There'll be a lot of strategy needed in future year budgets as everyone's facing cuts. Grant funds aren't lasting forever. There's just a growing community as it is. So constantly looking at ways to both be efficient in our current workflow and then be realistic about what we're going to need moving forward.
Sure.
All right.
Next meeting tentatively?
Is next year.
Oh my gosh.
Oh,
So,
yeah. So what's our,
let me think.
what are we doing?
What are we doing?
What
So
are
we
we
met
doing?
in October. We do. So January, February, March.
You skipped December.
May, June. Did we do January, April, July, and October? I can't believe we did July. Did we do January, April?
No, it seemed to me we took the summer months off.
Yeah,
Yes.
we didn't meet in July.
When
July
would we
and
have August?
No. No, I don't think we did.
No, I think we did January, April.
May. January, May.
So we have to meet 4 times, correct?
Yeah.
I think we just did January, April, August, November.
We did do August?
Yes.
Okay.
Yeah, we met in
You
August.
think we did?
Yeah, August 12th, 2024.
Oh yeah, our minutes.
Yes.
Yeah.
I mean, because it's written here?
Yep.
You mean they actually did it?
Oh,
Yeah, so January, April, August, November.
So it will be, let's see here. The second Monday is, oh, I already have it marked down. January 13th.
Okay.
I'm okay to you.
April 14th.
That'll be in the minutes.
Sure. Yes.
so you don't have to write it down right now.
January is the one that is in the head already.
August 11th. And then October 13th. All right. It will go in the minutes for
Okay.
permanent documentation of 2025 meeting dates. Is that still working well for everyone? It seems like, with the exception of our last meeting, it's worked very nicely with getting the quorum.
Yeah, I don't know what happened last time, but just
Was that
somebody
last
didn't-
month?
We just had a lot of
I
commitments.
had conflict.
Yeah, we had a lot of conflicts.
And are we fully staffed with the board?
Well, we have Debbie who stepped down this
Oh,
week.
right.
So I do believe there are applications in the file, so
Nice.
we'll be able to look at that. But we'll still have quorum. We still have enough people that will be making quorum.
Yeah, but I didn't realize you had a backlog of people that you could.
I don't. It's kept in the main office here,
Oh,
but I
the
think
secret
there are
office.
people in it.
Oh, perfect.
I'll have to double check, but I did email them today and let them know about Debbie.
Well, that would be wonderful.
See, yeah, definitely. But if you
Changing
guys
that.
know of anyone who you think might be a good fit or interested, that's always open for people to put their name in if they would like to serve on a board.
Well, from your point of view, do you have the resources you need from the board? I mean, is there some other person?
Different perspective.
Yeah,
Yeah.
yeah. That's your call.
Yeah. Right now it's serving us really well. I feel like we have a nice diversity about lived experiences and different roles. But I'll definitely be thinking about that too, or of people that could potentially serve in future years to come who might have an interest.
Well, with that, I would entertain a motion to adjourn. Did you make that?
Yes, I
motion?
did.
Oh, okay.
I'll second.
All righty. We have a motion and a second to adjourn.
Thank you.
At 7:25.